Let's get edited out or what?
Are you ready?
Mm-hmm.
Our second go at this. And we're rolling, baby, with the Berman Method Podcast. Dr. Jake Berman here with my beautiful co-host,
Jenni Berman, physician assistant.
We are David going against Goliath. Goliath being the corporate medical system, big pharmaceutical companies, the health insurance companies. They do not have your best interests in mind. They will choose profits over patient outcomes every single time. And that's what we're all about, is there's another way.
Absolutely.
Yeah. So we've got an exciting day today, but we're still trying to get into the groove of this video thing. Like, this is fun. We got a different setting here today. Jenni gave me some good coaching before we pressed play. I'm like, have you been doing research?
Just watching others. That's how we learn.
That's how we learn.
Coaches, watching,
Yeah.
learning. That's why you tell everybody that you learned it on YouTube.
I learned it on YouTube.
Just watch a YouTube video and I got it.
I watched it last night. I'm like, okay, this is what we're going to do.
That's what you told my parents the first time you ever got up on the wakeboard, like behind their boat.
Is that what I said?
They were like, have you done that before? You're like, no, I just watched it on YouTube once and I got it. I'm good to go. As he's like jumping the waves. Natural athlete.
I don't doubt that those were the exact words that came out of my mouth.
I'm 100% sure it was. You're like, yeah, I just watched it last night. I got it.
Yeah, that's me being as humble as I can possibly be.
Just a natural.
Yeah. So we're in the heat of it. This is coming out in July, and we're in the heat of summertime. We're literally, figuratively, having some fun. A lot of boat days.
Yeah.
Yeah, we visited some friends over the weekend on the East Coast, got on their boat.
Mm-hmm.
Completely different boating in the ocean versus the Gulf.
Yeah.
That was a lot of fun. Put some miles on it.
And the 4th of July week is one of our favorite weeks of the year.
Yes.
Got to experience that.
Yeah, go Team America. Happy 250, baby. Let's go.
Yeah. Speaking of wakeboarding and water skiing and potential injuries. Oh, and inflammation.
Oh,
That's what we're talking about.
that's what we're going over today.
Yeah.
Inflammation.
Talking about inflammation, and even though your labs are normal, you still feel this inflammation. So you're having joint pain, you're having abdominal gut issues, you're having headaches, you're having, these like achy joints or tight muscles in the morning when you wake up. And the first thing you do when you go to the doctor and tell them about this is they say, we got to run some labs. And you run some labs, and the labs that they run are normal. But you're like, okay, everything is normal, but I'm still feeling this inflammation and joint pain and stiffness and muscle tightness and gut issues and headaches and migraines. So what's the problem?
Isn't it you're just getting old?
Oh, well, if you want just like to deal with it and take the cop out.
Isn't that the most common excuse, though? Is, I guess this is just what getting older is like.
Yeah, and unfortunately, it's not the fault to the clients. A lot of times, that's what they're told when they go to their primary care, and they say, well, your labs are normal, and you are getting older, you are having hormonal change, and sometimes you might just have to slow down a little bit.
Oh, I hate those words. You're getting older, just slow down.
Yeah, but unfortunately, there's a word but.
Oh my gosh.
Unfortunately, do you hate that more?
Oh my
Which one do you hate more? But, like, I think,
is the worst. We don't even know that you're saying Have you ever just listened to people talk these days? Everybody starts a conversation now by saying
Even Walker does.
I'm going, what are we doing? What world do we live in now that we can't be in any silence anymore because it's too awkward, and we just have to fill that silence with the word
Mm-hmm. And
I think. Well, do you think or do you know?
Mm-hmm.
Like, I don't want somebody that thinks dealing with my healthcare. I want somebody that knows.
Yeah. Okay, so getting off of your Jakeisms here and getting back to what the doctors are telling you. So the point is your labs can be normal, but you're still experiencing this inflammation, and it is something. It's not just that you're aging. It's not that we need to slow down. there is something going on. You just need the right provider to help you dig into it and figure it out.
Okay. Tell me more. You got my attention now.
Well, there's a lot of different causes to inflammation, right? Kind of depends on what you're complaining about. Are you complaining about headaches and migraines? Are you complaining about joint pain, your gut health, your bowel movements, your reflux, your heartburn? All of this is inflammation. It's not just swelling of the joints, although that's inflammation too. And that's something you see every day is people actually physically show signs of swelling, which is inflammation. And I see more of the symptomatic inflammation where they're coming to me with symptoms and we actually have to dig a little bit more to find the problem. I think you have to dig to find the problem too, right?
There's always digging.
Where it is, it ain't.
Where it is, it ain't.
Which I think we talked about last time.
Yeah, wherever the pain is, ain't where the problem is.
Or the swelling isn't always exactly where the problem is either. There's usually something contributing to that.
Yeah, perfect example. A lady just came in last week. Her right knee was swelling. She goes, why is my right knee swelling? Well, because your right glute ain't doing its job. Mm-hmm. That right ass cheek is not doing its job, which is placing increased stress on the right knee, causing it to swell.
Right.
So we could spend years treating that swelling knee, but if we just go to the root of the problem, which was the hip, one level above,
we'll do it 100 times faster.
Million times.
Million times faster.
11 billion.
Oh, I thought it was 100. But it's simpler when you actually figure out where the problem is. It's not so stressful on you. It's not as frustrating. We see faster results, and we can actually feel better and move better and live better. But anyways, let's talk a little bit more about inflammation. It's more talking about acute versus chronic, right? So I see a ton of chronic inflammation where it's been going on for a long time. Started actually back in your 20s, but maybe you didn't actually show signs and symptoms until you were 45. But chronic is going to be your more long-term inflammatory process, the systemic inflammation, meaning inside and out, head to toe inflammation. Versus the acute inflammation is more what you experience when you actually have an injury, right? So you step wrong off the curb and you twist your ankle and it swells up. That's acute inflammation. You probably don't see a ton of acute inflammation.
Very rare.
Unless it's post-knee surgery, right, where they have a knee replacement.
Yeah, I mean, even then, it's probably 99% chronic. It's probably 1%. I just tweaked my back, I just tweaked my knee, I twisted my ankle. It's just so rare.
Yeah. But even the case where we talked about last week, or a couple weeks ago, where I twisted wrong in the chair helping Vera eat and my back spazzed up. Like, that was acute pain. Why do you laugh every time I bring it up?
I just think it's comical because it was so
dramatic that it hurt so bad. I was really broken. But that was like an acute onset pain. It wasn't acute inflammation though. It was chronic inflammation that built up to that threshold where the threshold was reached. And then I had acute, really, really bad pain.
You just brought up a great point right there. Think about this for a minute. Let's think about the continuum, the spectrum of inflammation. 0 to 10. 0, there's 0 inflammation. 10 out of 10, my back is killing me, my knee is killing me, my gut is killing me, I'm bloated, whatever it is, the symptoms are screaming at you, 10 out of 10. Just for simplicity's sake, you can have 0, 1, 2, 3, 4 on the inflammation scale and feel no symptoms at all. Mm-hmm. But as soon as you go from 4 to 5, that's when the trigger gets sent to your brain where your brain goes, oh, there's something going on here. There's an issue here. There's some discomfort in your knee. But then when it goes from 5 to 6, it's like, okay, that's not discomfort anymore. That's pain. 6 to 7, yeah, that's more pain. 10 out of 10, I can't walk on it anymore. So knowing that inflammation is a spectrum, a continuum of 0 to 10, and just because you don't feel something doesn't mean that it's not there.
Right.
Which makes sense why you just twisted in a bar stool and thought you broke your back.
Right, because it had been building. And we see that all the time on the wellness side where people are like, I've eaten like this my whole entire life and haven't ever had these issues where I am running to the bathroom, I'm having such severe loose stool or the bloating, abdominal pain, but then you go back and for the past 10 years they've had reflux and taken reflux medicine. So they've just been masking a problem that is actually causing an inflammatory reaction, and it just got to this threshold, that point of inflammation where the immune system's like, come out. And now we are coming up with other symptoms that we can't exactly avoid or just take a medication to fix.
Did you just say that taking a PIP, is that what it's called?
Yeah,
PPI? Did you just say that taking a PPI is not a normal thing? And even though it's a little tiny pill that you don't even think about taking every day, that there's actually a real problem that's occurring and that's not fixing anything and that's not normal?
Correct. And it's actually causing side effects. It's causing vitamin deficiencies, which then make your problems worse. Yeah.
But so it's such a small pill.
Hold on a second. You're taking this the wrong way. It is a small pill. And they are not good for you. But we don't need to go down that track right now because we're talking about just inflammation,
Okay.
So we have these symptoms, we go to the doctor, our CRP level, our sed rate level, which are two broad spectrum inflammatory markers, are negative. So do I actually have inflammation when these inflammatory markers are negative? Yes. It's a different type of inflammation that we're testing there versus what your body is experiencing in regards to having symptoms and pain response. So we have to dig a little bit deeper, understand where the inflammation is coming from. Now, so frequently on your side, physical side, and the chemical side, we're seeing that blood sugar and cortisol, which we've talked about so many times on this podcast, but blood sugar and cortisol are actually impacting the inflammatory cycle and the inflammatory system. When blood sugar is dysregulated, meaning it's going up and down all the time, or it's hitting lows, it's hitting highs, it's unregulated, that's actually increasing a stress response and an inflammatory response on the body.
So when I black out and I just eat 12 cookies and then I wake up and I'm like, what just happened? That's not good. Like that could be causing or contributing to my back pain or my knee pain if I had it.
Yeah.
Oh my gosh.
And your gut health and your headaches and your muscle tightness.
Now that we got a video podcast, I do have to go back and reference that statement when I black out. That's actually a reference from old school when Will Ferrell was in the like some type of intelligence competition and he's on stage and he said some answer and he just wakes up. He's like, what did I say? I don't know. I blacked out. So that was supposed to be a funny thing, not literally alcohol-induced blackout.
Correct. Yes. That's not the blackout we're talking about.
So anyways, coming back to it, we could go and we could eat pizza and drink beer, spike our blood sugar, and then it crashes at 2 or 3 in the morning and rinse and repeat throughout the entire weekend. And then Monday rolls around and we wonder why our knee pain, our ankle pain, our bloating, or whatever it is significantly worse than it was on Thursday.
Yeah, not to mention probably what you're eating that is spiking your blood sugar is our toxins, right? Whether it's gluten or dairy or carbs or sugar or alcohol, like yes, those are toxins and absolutely can also contribute to the inflammation, but it's the blood sugar regulation itself that actually stimulates a stress response, a cortisol response on the body. Cortisol is that stress hormone that we've talked about on many podcasts before, but cortisol is a steroid hormone and it actually causes the body to react in an inflammatory way. It sends the body into that fight or flight mechanism, which can increase that stress response, inflammatory cycle.
Okay, so like a self-fulfilling prophecy, downward death spiral of pain.
Sure.
Or inflammation.
Yes, absolutely. Yeah, and whether maybe your blood sugars is regulated and you eat very clean and you're getting your protein, you're having your fiber and your vegetables, but we're enduring this cortisol response from external stressors, your job, your husband, your kids, or wife.
Wait a minute. Whoa! Your husband?
Running a business.
Oh my gosh.
Being an employee of an employer.
Holy pivot.
Taking care of your parents. Right? So finances. We have all these external stressors, but then we also have internal stressors where you may be eating super clean, but you have an egg allergy or sensitivity. And so you're consuming egg whites because it's healthy. But this egg sensitivity is actually causing an internal stress response on the body too, which is leading to an inflammatory cascade. The immune system is struggling. So because we're consuming foods that's stimulating an immune response all the time, the immune system can't keep up with all the antibodies, these inflammatory markers that are now housing in your joint and causing your joint pain, or in your gut and causing gut issues.
That's a big one where so many people think that they're eating healthy, and on paper it is healthy. But if your body has a sensitivity, notice sensitivity is not an allergy, but if it has a sensitivity to that healthy thing, eggs, for example, is a big one. You think you're doing the right thing. There's so much protein in eggs and good cholesterol and all the great things. This year, we're allowed to eat eggs.
Yeah.
But you're actually creating inflammation.
Right. It's the same thing. Almond is so popular right now because it's low carb. It's a replacement for gluten-containing products, but it can be so inflammatory for people.
That's you.
Yeah. I have an almond issue for sure.
Man, it is almost instantaneous.
Yeah.
Like within minutes of consuming almond, your throat swells up, and you can't swallow anymore.
Jason, what's wrong with you?
Just had almond. That was almond creamer, wasn't it?
Yeah. I feel like an elephant is sitting right on my trachea when I consume almond. And it didn't used to be like that. It started pretty much after I had Walker, which means like my body went through a stress response. I mean, we all know how my delivery with Walker went, right? We podcasted on that too. So if you haven't listened to it, you should go back. It talked a lot about experiencing corporate medicine in the hospital and getting answers 5 days after I was complaining about concerns, right? But that was a stress response. I had a CSF leak, was in the hospital for days, got out, went back, was told that my symptoms didn't align with a CSF leak when we kept telling them it is. Anyway.
Oh my gosh, let's not go down that road.
Yeah. But that like sent me through this stress response for sure, between the trauma of having C-section, and then that happened after, and Walker had some testing that he had to have done at birth. Like, it was stressful. And then after that,
no more almond.
No more almonds.
It's like, man, that was our go-to, coffee with almond milk, almond creamer.
And almond flour, I used it all the time.
A lot of almond flour.
Yeah. One day we'll get back to it, right? We just got to go through the healing process. And
Wouldn't you have to cut out peanut butter to go through the healing process?
Right. Peanut is not almond. We don't need to talk about my sensitivities right now. We don't need to talk about the Christmas tree of my sensitivity list at the moment. Now that we won't have any more babies, I can actually, I think, go through some healing.
Okay.
Right? Like,
yeah.
Pregnancy is so hard on you. Yeah. But anyway, let's talk about like what we can do. You know, as far as when we have this inflammatory cycle, we know that blood sugar is involved, we know that cortisol is involved, and 100% the gut is involved, right? Because majority of our antibodies, or all of the antibodies, these inflammatory markers, start in the gut. So our gut health 100% contributes to the inflammation that we have or don't have in our body. So we gotta go through the blood sugar control, the cortisol control, the gut health. But then even when it's a joint related issue, we have to make sure that the gut is healthy and that the immune system is healthy. But then we also have the physical components and the regenerative components to help with inflammation, whether it's a joint, a gut, or a cortisol response, which we're using for a lot of our wellness clients.
Yes,
right?
We are.
Like one of our most complex wellness clients right now are seeing the physical side for EMTT over the gut.
Yeah, we're putting that right over the stomach, and it's helping.
100%. So EMTT actually helps with getting down to a cellular level for healing, right? To allow the cells to heal, reducing inflammation, antioxidant effects, which means it's getting rid of the bad stress, the oxidative stress in the body. And it's as simple as laying on a table and putting that arm over your gut.
Yeah, the arm of the machine just laying, and all you have to do is lay there. It's as close to the easy button as you can possibly get.
Yeah, you can't have your phone, but you just lay there.
You just lay there.
And then the stim pod for the vagus nerve, which the vagus nerve is the nerve that innervates the most organs in the body, not all, but most. And actually is the nerve that controls the stress response or the cortisol response in the body. And so using the stim pod, which helps with nerve regeneration, calming down the nerves, getting them to function efficiently right over the vagus nerve, is extremely valuable in bringing down that internal inflammatory and stress response on the body while we're going through the gut healing and the physical training to strengthen the muscles around where the joints are being bothered.
It's just a complete encompassing, an all-encompassing approach to knocking out inflammation from every aspect that we possibly can. 10 years ago, I had one tool. Today, it's like, oh my gosh, there's 11 billion different ways that we can go about this thing with all sorts of different combinations where we're speeding it up at least 10 times.
Mm-hmm. Mm-hmm. And getting out of the realm of the frustration of not getting answers, right? But we want to make sure we're targeting all areas of inflammation and not just taking a pill.
Which is what most people want to do.
Yeah.
You know what I think? A prediction that I have right now is like 100 years ago, it wasn't normal to get annual blood work, and it wasn't normal to go to the dentist every 6 months to have a teeth cleaning. Those weren't just normal things. And over the years, research shows that there's a lot of preventative steps that can be taken if you do these things on a regular basis. So that's what led to getting an annual physical and getting blood work done annually. And that's what led to dental or oral hygiene and going to the dentist every 6 months to scrape the fur off your teeth. I think what we're going to see now is that your gut has to fit into that equation too. The food has just changed so much in the past 30 years alone, where it's not food anymore. It's so easy to go anywhere and look at something that looks like food, consume it, and it's really not. It's filled with chemicals. And the reality is it's not food at all. I mean, the hamburger, the McDonald's hamburger example is the best example you can have. You put that thing in the back of your car, you forget that it was there. A year from now, it looks the same. Mm-hmm. That's not okay.
Mm-hmm. Right. And actually, you just jogged my thought process on, you said the dentist, like, your oral hygiene is one of the most important things when it comes to your immune system, your heart health, and your gut health.
What? Maybe that's why I'm so good, because I go 3 times a year, if not 4.
That's why your heart's so healthy.
That's what it is.
There really is like a correlation, yeah. Wow, brain fog. To cardiovascular disease and oral health. And increase of plaque and.
Don't they say not to go to the dentist after you have a surgery because of that? Scrape plaque off, get into your bloodstream, and cause an infection?
Yeah, well, some people have to actually take antibiotics when they go to the dentist to prevent any potential infections. Yeah.
Anyways, to get back to it, we're at a turning of the tides here. We're learning more. We're in this phase of learning and continuing to learn. And your gut, it's just silly to ignore it. You think that you're fine, you're not fine. There's no way for you to be fine in the world that we live in right now. Yeah. It's just not possible anymore unless you live in Jamaica in the mountains and you don't go to the resorts and that's all you do is you eat bananas and whatever fish you can get from the ocean. Then okay, you don't need to do this stuff.
Well, even, again, like the amount of clients who are fiber deficient coming in, like fiber is one of the most important things to reduce inflammation, to reduce your cholesterol, to improve your gut health, to keep your bowel movements consistent. Like, people think of fiber as like having a bowel movement every day, but that's not the only thing it does. It lowers blood sugar, cholesterol, helps with satiety, helps with actually getting the right bacteria, the good bacteria in the gut. So even again, if you are eating well, you may be consuming sensitivities and probably not getting even enough fiber or protein in your diet. So yeah, we can't just fix where the swelling is. We can't just say we have inflammation and we're getting older because our labs are normal. There's more to it.
a whole lot more to it.
Yeah.
And that's what we're here to help you figure out so much faster.
Getting real labs done that actually show things.
Yeah, what is it? Your GP orders 6 labs or 4?
Oh, 3 to 4 usually.
So in your annual, they do 4 labs, and they get those 4 labs and they say you're healthy.
New normal.
Yeah, versus when you come here, it's 17.
Consistently 14, occasionally more.
Okay, so it's 10 more things that we're looking at, and it says you're not normal.
Well, yeah, and I don't want to scare people to say, like, we're going to find a problem. But if you're coming...
Well, isn't that what we're trying to do?
You know, if you're coming here, you're usually coming for a reason, right? So we're going to dig and we're going to look at actually what's necessary to figure out what is going on. But we're not just ordering things just to order it.
Yeah,
There's a reason.
This isn't an example of the total body MRI.
Right.
A total body MRI, you can ethically debate why you should not have that done until the cows come home. This is just straight up, you've got a symptom, you're coming in, we're not going to run a panel of 4, we're going to run a panel of 14 to try to figure out what's causing that symptom as fast as possible.
Right. And see results. So, that's it.
Good?
Yeah, I think so.
Okay, make sure you go to bermanboomers.com to see if you're on track to arrive at 80, feeling 40, and if you're already in your 80s, kick your 90s ass. And then we also recently launched our new website, bermanhealthclub.com. So go check out our new website, bermanhealthclub.com, and click around. Let me know if you find any glitches. Don't let me know if you find any glitches or typos. Let Jenni know. I'm not dealing. Yeah, I'm not dealing with anything. Good?
I think so. Chopping it.
Yeah!